I'd like to give you the opportunity to spend some time now with Lou Haggerty, your webinar consultation closure trainer specialist, and she's going to go through some of her methods, some of her proven methods for phone closure training. Lou, I turn this awesome early morning crowd over to you.
Thank you, Greg. First thing we need to do is remind all of you, because the one thing I'm very pleased to hear is that all of you, that there's several of you from your offices that are participating. So I want to just let you know that you have to always remember that you are a team. All of you are a team, and each of you has to think of yourself as a patient care coordinator in the way that you have a knowledge, confidence, and understanding of the treatments and services that are offered within your practice and in your program, in your company. So you have a responsibility to be an active part of patient acquisition and retention. And the key part is not only acquisition. We know that the doctors and the owners spend a lot of time bringing individuals into the practice, but it's all about the retention, keeping them in and encouraging them. Handle fee quoting on the phone. If you have ever had any of POC's sessions or trainings, you know that we have an edict that you do have to answer fee quoting questions. So you have to have some method of being able to know how to handle fee quoting over the telephone, because that is the first communication you're going to have with them. Be prepared for all types of inquiries, because you're going to have all types. Of course, when you're doing ads or you've done an e-blast, you're anticipating those kinds of questions, but you will have other people calling in. My mouth to God's ears. Getting the commitment. That's the key piece. What is the commitment? It's the person's name, address, phone number, email address. So we're going to see how to get the commitment, and then last but not least, follow up on all calls. So that is what we're going to be covering in today's session. Again, if you have additional information that you want, please feel free to send questions in. Remember, you never get a second chance to make a positive first impression. And the first impression is being made over the telephone. So it is important that you understand when you are talking to an individual that this is the first impression that the individuals will see of your practice, of your organization. I want to start off by going over what are some of the reasons why people call in. I'm sure all of you accept the fact that the first reason most often is price. So how do we handle it?
So, how much is your nose job? Well, I'll be happy to tell you, but would you mind telling me how you heard about our practice? Well, I saw your ad in the newspaper. Well, is this something you've been considering for a long time? Yes, it is something I've been considering for a long time, but what is the fee? Now, what are you going to do with someone like that?
How do you handle what is the fee? Can anyone tell me how you would handle or how you would go about handling if the question comes, what is the fee? Or would you want to just keep the caller calling, talking? Would you want to offer options for appointments? Or, last but not least, give the answer on fees. So what does this mean, giving answers on fees? It means that you have to have some specific ranges. Ranges are the most important thing to keep in mind when you're giving fees. Most of the time, people aren't looking for that's going to be $555.16. What they're looking for is for you to give them some idea of how much it's going to be, because that is why they've called in. We go over some other reasons for the inquiry. Curiosity. You're interested, individuals will call in because they're just curious to see what is it all about, this cosmetic services. Let us go over a few examples of the types of calls that you would probably get on the phone. I understand one of you is moving into this area and you have not really been in the area. Want to keep in mind that in most practices, the receptionist kind of is the backstop for answering the questions and then also triaging to the patient care coordinator. So both the receptionist or the individual that answers the phone who has that as their main responsibility has to understand how to handle these calls. And obviously the patient care coordinator who may be taking the calls from them also has to have this understanding. So let's look at some of the types of calls that you would
Now, Lou?
Yes.
How would you handle cancellations if a patient is constantly canceling their appointment? How would you handle that in a very professional way?
That's a very good question. We have two methods. Now, I'm going to go toward the end. I'll be talking about cancellation of procedures because of very specific reasons. But individuals keep calling in, they make the appointment, and then they cancel it. I have to say that I'm one of those people. So here's how you handle me. You would indicate saying that, we really understand that this is something that appears to be important for you. But what we're going to do now is we're going to take a credit card. Now, that's a biggie, and I don't know if you're already doing that. We're going to take a credit card, and we're not going to charge it unless you cancel. And the reason we're doing that is because our staff and the doctor has set aside the time to come, and they anticipate you're coming in, and your canceling is really, you're using up the resources of the individuals that are here waiting to help you. So we're going to take a credit card, and that is, it's a very bold move, but it is being done now. And if nothing else, and what are you charging? We would say not charge the whole amount of a consultation, but charge a nominal amount of the consultation fee to let them know that they can't just continue to waste the practice's time.
Okay, thank you.
You're welcome. No problem.
Yes, Lou?
Yes.
What if you have a client that's been coming to you for a while and then they want to stop coming all of a sudden?
Are they, and they've been getting specific types of treatments or
Yes.
services? Okay. Well, in that particular situation, we find that whoever is the technician or the esthetician probably has a relationship with them. But if you sense, and here's the key piece, if you sense the problem may be the relationship between the technician or the esthetician, it may require that the office manager or the doctor communicate with them and just let them know that you're concerned because you know that this treatment plan is the best way for them to achieve their desired goal, and you just would like to know, is there a specific reason why they're no longer making or keeping their appointments? So it does require that somebody, and you have to figure out, and here's where it really takes sensitivity of determining who is the best person to make the call. I would say the doctor would be the last person, only because women especially lie to doctors. I know you don't believe that. They don't want to tell doctors bad news. And most male doctors don't want to hear bad news, okay? So even them making the call is not the best. But if you have an office manager who's not tied to the procedure or the service, that might be the best person to make the call with a genuine concern. And it always starts off with, we're concerned because we know that this treatment plan is going to help you achieve your desired goal. So we're concerned when you're no longer keeping your appointments or making your continued appointments. And you might find out that it's a money situation, and if it is, then you can work with them. If you find out it's a personality situation with the individual that is doing the service, then you have to figure out what are your options. If they found a cheaper place, I mean, because these are the things that I would think would be the reasons why they would stop. Then you have to decide if that really, if they're getting the services at a cheaper place. I always tend to want to say, you get what you pay for, and you really want to use your face as an object for discounting. But you say things like that very nicely. Sometimes it depends on what framework I'm in, I sometimes get a little gruff on that. But that's how I would do it.
Okay, thank you.